Next, we've got collaboration versus consultation and action with Heath Tolley from Te Whatu and Swithin Foote from Middleware, New Zealand. They're unveiling New Zealand's digital API standards. They're going to do a bit of a double act with Heath up first. Obviously, we've got some fun facts about both of you two as well, so you're not going to escape. Heath once won a local talent show by performing an intricate juggling routine with medical supplies, which was always fascinating to see. Yes. And Swithin has a quirky talent. He can solve a Rubik's Cube in under a minute while blindfolded. So, again, you can go after the balloon show with Callum later.
Ko Heath Tolley, tōku ingoa. Topic today is about consultation versus collaboration. Spoiler alert, we prefer collaboration. And a presentation about collaboration wouldn't make sense without a little bit of collaboration, but we've only got 10 minutes and we do want to talk about it a bit. So I will just get a broad sense of the room. How many in the audience today are involved in some way or another working with standards, creating, maintaining them, or supporting them? Show of hands. Yep, brilliant. Everyone else, not sure what you're doing, but I think you really need to be. We want to get some good questions from into the Slido, but not only questions, we want comments, feedback, ideas. We're going to ask for ideas. We really want to kind of understand what you guys think about this and if it's something that we can kind of keep doing. A little history to start. There we go. A little history to start. So Te Whatu Ora Health NZ was formed in 2022 after the health reforms. So we've actually inherited a lot of the kind of operational process around healthcare with the former district health boards, but we also have a stewardship and leadership role that we've inherited from what was the Ministry of Health. And one of the great features of the New Zealand Health Service is our broad and diverse, unique ecosystem of partners, community, technology creators who are in the sector building and creating tech. It's really awesome. The other kind of key strength we have is a large and dedicated health information standards organisation. We call it HISO. They leverage international standards. They create and drive our technology and data standards, and they're particularly focused on interoperability, ensuring data flow across the sector. A quote from their website to describe what they do. So working with subject matter experts and stakeholders, we determine the standards that have national effect and we manage their rollout. So as you might expect, this is great. We consult with the wider health sector, we get their views, we publish robust, well-articulated standards, they're well known and they're well adopted by the community. Having these clear standards results in lower duplication, greater interoperability, consistent information to support healthcare across our dynamic health ecosystem. Except we don't have that, not even close. Information doesn't flow. It's held in silos. It's not complete and it's not accurate. I don't know how many people have visited their GP lately. They do not have access to the information that's collected in hospitals. So what's happening? The sector is really, really slow to evolve. The standards are driven from the centre without buy-in from the community. It's just those who we consult with. It's slow to change. A standard can take up to 2 years to change, even when there's an error in it. And a lot are badly out of date. This isn't really moving forward. So we were wondering if there's a better way we can do this. I'm going to hand over to my partner in crime, Swithin, to answer that question.
Thanks, Heath. Now, I need to go onto this one. Kia ora, everybody. My name's Swithin. Thanks very much for coming along to listen to us today. So how do we start? How do we start what Heath's been talking about? So we had both seen the consultation approach fail in the past. We're both getting a bit long in the tooth, so we've been through this journey many times. So we knew that we needed the concept of an open, engaged, and collaborative community. So a quote from Mother Teresa here, which is apt, I guess, in the context. I alone cannot change the world, but I can cast a stone across the waters to create many ripples. And I think that was really, really apt. So if we go on to the next here, a community. A community is a group of people who share common interests, values, or a sense of belongings, often connected through shared goals and activities. So that's where we started. We started with we needed to create a community. Of course, a community without guide rails becomes Lord of the Flies. I'm sure you're all familiar with Lord of the Flies, having been to school in New Zealand, a lot of you. We all studied that in fifth form. So an effective and collaborative community doesn't necessarily require leaders, but it does need to have guidance and, to some extent, some rules. So how did we go about setting this up? The first thing that we did was we created some community roles. It's worth pointing out here that we hadn't identified any individuals for these roles. We just thought about some of the things that might need to be occurring within this community that we were creating. We created 5 key roles. We created members, so that's anyone who has an interest. We created participants, so they're active users of the standards. Contributors, those are who are submitting changes to the standards. They could be probably referred to as subject matter experts. Moderators, those who monitor the community. And working groups. So occasionally we thought there would be periods of high change activity where a focused group would be required to input to the standards. And we created a collaboration process. So that's really guidance around contributing and participating within this community. We created some guidelines. So how to communicate effectively was really important. We also created a code of conduct, and that was based on two principles. So the 2 principles were participation in the community is a harassment-free experience for everyone. I think that's really important. And members will interact in ways that contribute to an open, welcoming, diverse, inclusive, and healthy community. So those are the 2 core principles that we designed it on. Unfortunately, we have to prepare for the worst. We had to set up some moderation capability, but to us, moderation, it's not about censorship. It's simply there to ensure that the community is respectful and that the content remains on topic. There was a danger of it sneaking off topic. And there was some guidance around getting involved, some guidance on how and when to participate. So we needed some tools. We needed some tools to make this fabulous new ecosystem work. And this is the fun bit. This is what I really enjoyed. We needed a way to manage the content. There's a lot of content to manage and to enable participation and contribution that would suit the needs of the community. It wasn't completely clear at the beginning what we needed, but it was very, very clear what we didn't. So static Word documents, spreadsheets, emails, they just weren't going to cut the mustard for us. We needed a modern web-native user experience. We needed to support the iterative change, and that was the outcome that we were after. We thought maybe we could apply software engineering thinking. A little bit of bias, that's my background. But in order to make the ecosystem open and collaborative, community ownership of the collateral was fundamental, was key. So an open source approach made so much sense. We wound up with quite a bit of stuff, but I'll start with sort of a bit of a high level. GitHub we chose as our primary way of managing the documentation, and the reason behind that is it's cheap, which is really good. It's functional, it's practical, super developer friendly. Every developer knows about GitHub. Everybody knows about GitHub, really. And it enables us to manage and track changes in a positive and collaborative way. It's very transparent. and it gives you that audit. It lets you see the history of the document. We use Plant UML primarily for our diagramming, and the reason for that is Plant UML is a text-based diagramming language. We can manage the history we can manage diagrams like code. We can see the history, we can audit, and we can see the evolution of a diagram over time. Again, really, really important and really collaborative and transparent. And we use something called Docusaurus for our publishing, primarily because the name's so cool, but also it's a really flexible. It's open source, so it's very highly customizable, and it supports really diverse needs. So it supports the needs of a really deep developer or someone who's not necessarily familiar. It's based on Markdown as the language that it uses to publish. So I'm going to rush on because I think we're probably going to get close to time. So a few stats. GitHub gives you nice stuff, but a couple of things I just wanted to highlight. We have, since we went live in February this year with this, resolved 108 issues, 387 commits to the code base, 67 merged PRs. We've published 3 versions of the standard, so version 1, 1.1 and 1.2. We have 350 odd Markdown files and nearly 35,000 lines of Markdown. So that's quite a lot of content to manage. If you imagine that in a Word document, that's a big old tiring read to try and get through. A few stats on the website. I didn't press the right button. Here we go. So we've had just over 2,500 unique users. What's really important is 200 plus unique viewers of draft content. So the way that the website works is we publish a draft version to GitHub. That draft version gets reviewed by the community. The community provide feedback and issues. In some cases, they'll contribute changes, and then that will be published into the published version. So this is all completely public. 20k odd page views. Average engagement time in the draft section 3.5 minutes, which seems like quite a small amount of time, but it's actually a relatively good. People are looking at this stuff not as part of their day job necessarily. They're going and finding a piece that's relevant to them and potentially providing that review and feedback. So as you can see, there's been some success. We've had real contribution. We've built a community. We've got some technology that's really working for us. But what have we actually gained? And that's where we go back to Heath.
And Swithin didn't see the hurry up we were getting, so I'm going to have to rush through these last slides. What have we gained? Well, this has actually given us a really good set of accessible standards that our partners, the health ecosystem, are invested in and actually contributing to, which is brilliant. As you can see from the stats that Swithin presented, there's actually a really growing community around this. Quite a lot of people are engaged. Quite a lot of the health sector technology partners are engaged in helping us to develop this. That really represents an asset, we think, for the health sector, in part because it's a group that we can engage and test ideas with in other areas, not just around API standards, which are pretty narrow, but anytime we want to try new stuff, test a new service, that's a community that can be brought around that to engage in those sorts of things. It's a place and an audience to kind of share and collaborate. So we're getting lots of good feedback. So that feedback is continuous. Issues are identified in the standards. We're not perfect. We make mistakes. We don't identify new things that are coming along, and our community are really giving us that feedback in real time, and we're able to update that. As you saw, those standards are continually evolving. And it's also giving us a bit of insight into how our partners in the health sector are thinking about it, what their capability is, what's kind of coming in their minds. So it's kind of creating that as well, which is awesome. What's next? And there's a few sort of things happening. So we've really been focusing initially on building that community. We've published a few of the standards. We've published an initial kind of set of standards around APIs and interoperability. but not a lot. We haven't done a lot of change in there. So we're looking to actually grow and foster, nurture that community to start, make it available so that we can drive stuff out. We're going to ramp that up a little bit over the next few months. Things are pretty difficult in Te Whatu at the moment. I don't know if people have been reading the news, but we're going to keep things like this going. We're going to introduce some new tools to help develop those, to support the standards. Similar to Callum, we've built a test suite that can run against your service and automatically give you a score about your compliance to the standards, which is awesome as well. And we're very, very keen on reuse. It's a big mantra in our team. How can we reuse this tool in other areas, not just within Te Whatu, but also across other government departments as well, maybe. So that's it. And I think that was my final. We spot on. Excellent. Just go to the next slide. Okay. QR code has got a link to the website. Actually, go on and have a play. Find an issue, raise it, let us know, and it's also got links to Swithin and I if you want to chat more.
Oh.
Yeah, you got questions, guys?
Not that QR code though.
No, different QR code.
Okay, we can go back to it.
So you can choose who's going to answer these, but what about a data sovereignty first approach where my health data is mine instead of being spread across however many providers? There you go, you just got hospital past that one.
What a great question. So I think there's a few challenges to this. So we have some legislative challenges in this space in particular. It's not super clear who owns health data, and our health privacy code, which is one of our standards, doesn't actually clear it up. So in Australia, what they've done is they've just put in a piece of legislation that says the consumer owns the health data, which is excellent, and that it should be portable. It should be shared by default. I think we need to do something here as well to solve that problem, because that is one of the challenges we have. Providers, clinicians, that's some of those silos we talked about. That's where your data is. So I think we solve it with legislation, and then there's tech that comes along to help support that.
Thanks. This should be right in your wheelhouse, Swithin. So how much engage... Oh, no, hang on, this keeps changing. Is that the latest top one?
Can I answer
Yeah,
that one if you like?
go for it.
Oh, how do you incentivize vendors to join this community and uptake
Take standards, yeah.
How do you incentivize them? The first thing you do is you make it accessible to them, not in the way that Callum was necessarily talking about, although I would be really interested to see the results. I have been running accessibility tools against the website. But how do you incentivize them? You make it easy for them to use. You do it in a way that's easy for them to integrate with. One of the things that Keith and I get a lot from the health sector is we all want to do things the same way, but nobody's telling us what that way is. And so we do it our own way because we're not being told. So part of it is giving them some skin in the game. So this whole community approach was really around. We've been in this industry a long time. We know a lot of stuff about, we know a lot about what good looks like, but we want you guys to contribute. We want you to be a part of it. If you're a part of it, you'll feel far more engaged. You'll be far more likely to want to apply the standard that we're putting out there. There's no point in us going out there and saying this is the way to do it. You have to do it this way, because people will naturally resist it. Nobody likes being told what to do. We're being told to go. Yeah. Thank you very much.